Pregnancy is often described as a magical journey filled with hope, anticipation, and joy. For many parents-to-be, it is a time of great excitement as they prepare to welcome a new life into the world. However, this journey does not always unfold as planned. Sadly, one of the most devastating complications that can occur during pregnancy is miscarriage. A miscarriage, also known as spontaneous abortion, refers to the loss of a pregnancy before the 20th week of gestation. It is far more common than many people realize. Studies suggest that 10 to 20% of clinically recognized pregnancies end in miscarriage, and the true number may be higher because many occur before a woman even realizes she is pregnant. The experience of miscarriage is not just a physical event but also an emotionally shattering one. It can leave lasting feelings of grief, guilt, and confusion. Understanding the causes, warning signs, methods of diagnosis, and available treatments can help demystify this painful subject, while also offering comfort and reassurance to those who may face it. In this article, we will explore miscarriage in detail, its causes, symptoms, diagnostic methods, treatments, and the emotional impact it brings. That a miscarriage is defined as the loss of a pregnancy before the fetus is viable outside the womb, typically before 20 weeks of gestation. If the pregnancy loss occurs after 20 weeks, it is generally classified as a stillbirth. There are different types of miscarriages, each with its own characteristics. Threatened miscarriage, vaginal bleeding occurs, but the cervix remains closed, and the pregnancy may still continue. Inevitable miscarriage, vaginal bleeding and cramping occur, with cervical dilation, indicating that miscarriage cannot be prevented. Incomplete miscarriage. Some pregnancy tissue has passed, but some remains inside the uterus. Complete miscarriage. All pregnancy tissue has been expelled naturally from the uterus. Missed miscarriage. The fetus has died, but no symptoms are present. The body does not expel the pregnancy tissue immediately. Recurrent miscarriage, defined as 3 or more consecutive pregnancy losses. Causes of miscarriage. The causes of miscarriage are often complex and not always fully understood. In many cases, the exact reason remains unknown. However, several contributing factors are well documented. 1. Chromosomal abnormalities. Most common cause of miscarriage, accounting for nearly 50% of cases, occurs when the embryo has too many or too few chromosomes, making survival impossible. These abnormalities typically occur randomly and are not inherited. 2. Maternal health conditions. Certain medical conditions in the mother increase the risk of miscarriage. Uncontrolled diabetes, thyroid disease, hyperthyroidism or hypothyroidism, polycystic ovary syndrome, PCOS, high blood pressure, autoimmune disorders, such as lupus or antiphospholipid syndrome. 3. Uterine and cervical problems, abnormally shaped uterus, scar tissue from previous surgeries or infections, incompetent cervix. The cervix opens too early during pregnancy. 4. Hormonal imbalances. Low levels of progesterone, a hormone crucial for maintaining pregnancy, can lead to miscarriage. 5. Infections. Certain infections such as toxoplasmosis, rubella, syphilis, listeria, cytomegalovirus, and bacterial vaginosis can contribute to pregnancy loss. 6. Lifestyle and environmental factors. Smoking, excessive alcohol consumption, use of illicit drugs, high caffeine intake, exposure to environmental toxins, radiation, heavy metals, pesticides. 7. Maternal age. Women over 35 years of age have a higher risk of miscarriage, largely due to increased chromosomal abnormalities in eggs. 8. Trauma or physical stress. Severe physical trauma or accidents can rarely cause miscarriage, though most normal activities do not. Signs and symptoms of miscarriage. Recognizing the warning signs of a miscarriage is crucial for seeking timely medical attention. Some symptoms may be mild, while others are more severe. Common symptoms include vaginal bleeding, light spotting or heavy bleeding with clots, cramping and abdominal pain, similar to menstrual cramps, but often more intense, passing of tissue or fluid from the vagina, sudden decrease in pregnancy symptoms, such as breast tenderness or nausea. Less common symptoms: back pain, dizziness or lightheadedness, fever, may indicate infection if miscarriage is incomplete. It is important to note that not all vaginal bleeding during pregnancy means miscarriage. Many women experience spotting in early pregnancy and go on to have healthy babies. However, any bleeding should be promptly evaluated by a doctor. Diagnosis of miscarriage. If miscarriage is suspected, healthcare providers use several methods to confirm it. Ultrasound examination, the most common diagnostic tool. A miscarriage is confirmed if there is no fetal heartbeat or if the fetus is not developing as expected. Blood test. Human chorionic gonadotropin (HCG) levels are measured. A falling or abnormally slow rise in HCG levels may indicate miscarriage. Pelvic exam, to check if the cervix is dilated or if there is tissue in the cervical canal. Tissue analysis. If pregnancy tissue is expelled, it can be analyzed for chromosomal or genetic abnormalities. Treatment options after miscarriage. The management of miscarriage depends on the type and stage of pregnancy loss, as well as the mother's overall health. Treatment may include 1. Expectant management, allowing the miscarriage to progress naturally without intervention. The body usually expels the pregnancy tissue on its own within a few weeks. Suitable if there are no complications like heavy bleeding or infection. 2. Medication. Misoprostol may be prescribed to speed up the process of tissue expulsion. Reduces the need for surgical intervention. 3. Surgical procedures. Dilation and curettage, DNC, a procedure in which the cervix is dilated and the uterine lining is scraped or suctioned. Used when natural expulsion or medication is not effective or safe. 4. Emotional and psychological support. Miscarriage is not just a physical event, it can leave deep emotional scars. Counseling, support groups, and open communication with loved ones are vital. Coping with the emotional impact. The loss of a pregnancy is often compared to grieving the loss of a loved one. Common emotions include sadness, guilt, anger, and anxiety about future pregnancies. Some women may even experience post-traumatic stress disorder, PTSD, or depression. Healthy coping mechanisms include talking openly with a partner or close family member, seeking professional counseling or therapy, joining miscarriage support groups, practicing mindfulness, meditation, or journaling to process emotions. It is important to remember that miscarriage is not the woman's fault. It is usually due to factors beyond anyone's control. Preventing miscarriage, is it possible? While not all miscarriages can be prevented, certain steps can help reduce the risk. Maintain a healthy lifestyle, balanced diet, regular exercise. Avoid smoking, alcohol, and drug use. Limit caffeine intake. Manage chronic medical conditions under the guidance of a doctor. Get regular prenatal care. Take prenatal vitamins, especially folic acid, before and during pregnancy. When to seek medical attention. Seek immediate medical help if you experience heavy vaginal bleeding, soaking more than 2 pads per hour, severe abdominal or pelvic pain, high fever or chills, passing large clots or tissue, fainting or severe dizziness. The road to future pregnancies. Many women who experience a miscarriage go on to have healthy pregnancies. After a miscarriage, doctors typically recommend waiting until after at least one normal menstrual cycle before trying again. If multiple miscarriages occur, additional testing may be necessary to identify underlying causes. Conclusion: miscarriage is a heartbreaking reality faced by millions of women worldwide. It is a deeply emotional experience that can leave lasting scars, yet it is important to remember that you are not alone. Understanding the causes, signs, methods of diagnosis, and treatment options can help women and families navigate this difficult journey with greater clarity and support. While miscarriage cannot always be prevented, timely medical care, a supportive environment, and emotional healing strategies can make recovery possible. For those who grieve, the path may be painful, but with compassion, knowledge, and hope, healing is within reach.